Hello everyone, welcome to my channel. In this video, we'll be studying about cubital fossa. So in this video, we are going to learn the concept, we are going to understand it, and then we are going to apply it. So what is cubital fossa? In simple terms, cubital fossa is a triangular hollow which is present in front of the elbow. And next, the cubital fossa is homologous to the popliteal fossa present in the lower limb. So we have one more fossa that is present in the lower limb. It is a diamond shaped fossa. We'll be dealing with this too in our upcoming videos. So it is a triangular hollow present in front of the elbow. Is it a simple definition for the cubital fossa? And next, it is homologous to the popliteal fossa in the lower limb. And next, in this video, we'll be studying the boundaries. We'll be studying the concepts of contents, and then we'll be dealing with the clinics. First, talking about the boundaries, we have lateral boundary, we have medial boundary, we have base, we'll be having apex, floor, and then at the last we'll be having floor. So I have told you that cubital fossa is a triangular hollow that is present in front of the elbow. So if it is a triangular hollow, it must have base, it must have medial and lateral boundaries, and then it must have a base. So let's study what makes its medial border, its lateral boundary, and then the base. So talking about its boundaries, lateral boundary is made up of the medial border of brachioradialis muscle. So now you have this. This is your brachioradialis muscle. Okay. The muscle you are seeing here is the brachioradialis muscle. What they are telling? They are mentioning here the medial border. So this is the medial border of your brachioradialis muscle. So this makes the lateral boundary of cubital fossa. And next, coming to medial border or boundary. Medial boundary is made up of the lateral border of the pronator teres. What is pronator teres? It is the muscle or the flexor compartment of the forearm. So this is the pronator teres. The muscle right here is the pronator teres. The medial boundary of the brachioradialis makes the lateral boundary, but the lateral boundary or the lateral border of the pronator teres muscle, so this is the pronator teres muscle, which makes the lateral border of the pronator teres muscle makes the medial boundary of the cubital fossa. And next, base. So how the base is made up of? Base is made up of neither the muscle or neither the bone. It is made up of an imaginary horizontal line. So you must remember that the base of the cubital fossa is made up of an imaginary horizontal line which joins the two epicondyles. So here is the medial epicondyle of the humerus bone. It's the medial epicondyle, and this will be your lateral epicondyle. And the line joining the lateral epicondyle and medial epicondyle will make the base of your cubital fossa. Clear? Now the apex. Apex is made up of the meeting point of pronator teres and the brachioradialis muscle. So here you are seeing the apex of your cubital fossa. It's clear now. It is made up of brachioradialis and pronator teres muscle meeting point. And next is the floor. So floor is made up of two muscles, okay? It is made up of two muscles, namely brachialis and supinator. I'll show you the diagram. So in this, you'll be seeing the floor of the cubital fossa. This is the brachialis muscle, and this is your supinator muscle. Okay, so you have upper and lower parts of your floor. So floor is made up of upper muscle and the lower muscle. Upper muscle, that is floor, upper floor is made up of the brachialis muscle, and the lower part of your floor is made up of the supinator muscle. So in this diagram, you can see the cross section in which supinator is highlighted so clearly. So this is the radius bone, and this is your ulnar bone. See how it is curling in between radius and the ulnar bone. So this is the supinator bone. It's clear. Now floor is clear. And next, we'll be talking about the roof. So roof from superficial to deep. Okay. Roof is like it is present from superficial to deep. What are the layers present? We'll be talking about that. Superficially, First, it is a skin. Skin is present, and below the skin you have superficial fascia, and below the superficial fascia you have deep fascia. Already learned what are the boundaries. So let's study about the contents. What are the contents? Contents are, you have to remember a mnemonic for its contents, that is MBBS. Okay. So what this mnemonic stands for? M stands for median nerve. B stands for brachial artery. Another B stands for biceps tendon. And S stands for superficial radial nerve. Okay. So here you can see this is your median nerve. And this is your biceps tendon. And this is your brachial artery. And this will be your superficial radial nerve. So you got the contents. That is MBBS, you have to remember. That is from medial to lateral. You got to know median nerve, brachial artery, median nerve, brachial artery, biceps tendon, and the superficial radial nerve. It's clear now. So now let's talk about talking about the clinical correlations. You have to learn about 3 points here. One is about median cubital vein. One more is brachial artery pulse, and third one is the fractures of elbow. Okay, so what is median cubital vein? It is the vein connecting basilic vein to the cephalic vein. Why it is important? Because it is a choice for collecting blood samples and giving intravenous injections. So whenever you go to hospital, if you have been visited, then for blood tests, they will be taking blood in the tube. So from where they will take this blood? That is from the basilic vein and cephalic vein connecting vein, that is median cubital vein. From here they will drain the blood. Okay, and next for giving intravenous injections also it is very important. And next about brachial artery pulse. You will be knowing about brachial artery pulse in your physiology examinations and physiological practicals you have in your classes, right? So there you will be dealing with the pulse, that is systolic and diastolic pulse. And next, talking about the fractures of elbow. So you have like very important structures. One is the brachial artery, and one more is your median nerve. Okay. So these two are very important structures because median nerve, sorry, I'm very sorry, this is median nerve, because median nerve supplies the muscles of forearm, that is the flexor compartment of the forearm, and if there is a fracture in your elbow, then there is paralysis of all the flexor compartment muscles. Flexor forearm flexor compartment is paralyzed. Okay, then you cannot flex. And then brachial artery is also there. So it is important for you to know what is cubital fossa and also what are the clinical correlations. Now you came to know that you have applied your knowledge in that. Contents, you have contents. That is in superficial fascia you have median cubital vein. So from here they will drain the blood for examinations, and then brachial artery pulse is important in your physiological examinations, and a fracture of elbow you must be very careful because you have two important structures, brachial artery and the median nerve. So if there is fracture, then you'll have a paralysis of all the flexor compartments of forearm, and also there is damage to the brachial artery. So so thank you for watching my video, and if you like it, please share, subscribe and give a like. So please subscribe. Thank you.